the carnival boss who led NCRHA during million-dollar SQUANDERMANIA, an editorial by Ken Ali. Davlin Thomas should be preparing a thorough explanation on the multi-million-dollar corruption and misspending at the North Central Regional Health Authority, NCRHA. Thomas was chief executive officer at NCRHA during the period when, according to current chairman Dr. Tim Gopi Singh, there was SQUANDERMANIA. Dr. Gopi Singh told of costly contracts being issued without transparent procurement procedures, of non-functioning essential equipment, of widespread cronyism, and other blatant examples of fiscal mismanagement. He reeled out a graphic story of gross misuse of taxpayers' funds while patients struggled to secure efficient and timely health care at Mount Hope and other NCRHA public facilities. It's not far-fetched to assume that such financial perversion was also rife at the other 4 regional health authorities. Similar stories of corruption and waste have been uncovered throughout the public sector. I have seen documented evidence of vulgar financial wrongdoing, but are especially distressing in the health sector. Thomas's dual role. None of that suggests that Thomas was guilty of corruption with the public's purse. But surely he has a responsibility to properly account to the nation. While he was in charge of 5 hospitals, including Mount Hope, the primary tertiary care facility, and 3 health centers, Thomas also served as vice chairman of the National Carnival Commission. Somebody upstairs really liked him. Even with medical crises under his watch, Thomas literally organized NCRHA, NCC's flagship pre-carnival event. In fact, he is described as an award-winning producer and artistic director. The Moss man managed 1,000 employees in the health sector, including surgeons, house doctors, nurses, and other vital professionals. NCRHA serves an estimated 375,000 people. Healthcare failures under his watch. While Thomas was doing double duty, there were several neonatal deaths, with NCRHA having a higher mortality rate, 15 per 1,000 live births, than the national average of 10 per 1,000 live births. There have been nursing staff crises, allegations of unsafe patient care ratios, recycling of medical essentials, and systemic failures. Amid a billion-dollar budget, there were surgical backlogs and shortages of life-saving medications. Accountability required. Thomas would surely have plausible explanations for the disturbing state of affairs and should waste no more time in presenting them. The country deserves to know why, for example, a $10 million chiller was never installed, $500 million were paid to security contractors without tendering, and $4 million overtime payments to plant a vegetable garden. These disclosures follow Prime Minister Kamla Persad-Bissessar's recent disclosure that $100 million worth of medical equipment at Kuva Children's Hospital was left to rot. The hospital is currently managed directly by the Health Ministry. Thomas, the health sector boss and ace moss maker, should step forward.